So, hello, I'm Dr. Emma Mellon, and with me is Dr. MadeleineLong, who is going to talk today about her experience with cancer and recovery. I know it's been quite a journey, Madeleine. Why don't you begin by just telling us the story from the beginning?
Sure. I wanted to tell you my journey today with Emma because I'm a medical doctor, so I thought I had some insight into the process dealing with cancer for so many years with my patients. But when it comes to having it yourself, it's quite another journey. So I had some abdominal pain one evening, and it was excruciating. Went to the emergency room, and they incidentally found a lung tumor in my lower right lobe of the lung when they did the CAT scan of my abdomen for the abdominal pain. And it turns out that I thought it was benign, but going into the oncologist preoperatively, she said, we're not sure, it's all benign. It was small and there were no nodes present, of course, until they did more of a biopsy. So we went into surgery thinking it was small with a normal PET scan that didn't light up at all. So the surgeon thought that that was totally benign and not to worry, or it was going to be a stage 1. It turned out to be a stage 3A, lung cancer, adenocancer. And
can you define that last part, adenocancer?
Adenocancer, that's a glandular cancer. There's also another type of cancer, a small cell cancer, but I had the non-small cell cancer. So anyway, I was shocked to learn that the nodes were positive when I woke up from surgery because they were so small and they didn't show up much on CAT scan. Then I had chemotherapy for 4 cycles, and during the chemotherapy, I had taken a lot of organic juicing because the oncologist had recommended that I was going to lose my hair in about 10 days after the chemotherapy started, and no such thing happened, it turns out, so it was miraculous. So I chalked it up to doing a lot of organics at that time and doing a lot of organic juicing. But chemotherapy was quite a journey, and so I knew the outcome of chemo. She had mentioned that the percentile of those living past 5 years was very small. In fact, it was almost like a placebo effect in some terms. It was only like 10% or 15% of survival for a 5-year period after that. So I knew I had to search out some alternatives. So that's when I went to the alternative programs.
And your life has been a different life since then.
Yes, I was so depressed, I think, with the diagnosis and the chemotherapy. And then after finding Gerson protocol, which is a program they do in California and Mexico, I did 2 weeks there with other patients from all over the world, from Vietnam and China. The Chinese people actually came to the healing retreat with me with their own interpreters, people from the States, people from Nicaragua. I can't tell you, people from all over the world. It was so inspiring to be with them, to go through that healing journey. And mainly it's a nutritional protocol and a detoxing protocol.
So you all went to Gerson, and just describe Gerson for us. What is it, a big organization?
But Gerson is predicated on Max Gerson's theory from the 1920s and he died in probably the 1950s or 60s, and he thought that he was healing cancer with nutritionally with organic juicing and detoxing, which entails coffee enemas and a lot of rest and cooking protocol that they give us there. And then there's certain type of enzymes that we did as well, enzymes and vitamins and supplements and to build your immunity back up so you can fight your own cancer cells.
And then you had that community you just mentioned.
Right, yes.
Yeah.
That community was inspirational. And then a lot of us are in touch by email around the world. So, and a lot of us strive to keep it going for 2 years, but I have since found other alternatives that I've incorporated into Gerson.
I see.
So
Also nutritional?
that's mainly nutritional, and then a lot of supplements as well, which doesn't include any drugs. So I'm feeling marvelous on the product, feeling very well. And I think it's helped me a great deal. But also the spiritual part and the psychological part has been also wonderful for me.
You had spiritual practices before you began having cancer, right?
Yes.
Have they changed or deepened? How would you
Well,
describe it?
you know, I've had a therapist all along, and that's helped me a great deal with my anxiety surrounding the diagnosis and the disease in itself. And I did a lot of meditation before my diagnosis, so I'm continuing to do that. That's been marvelous. It's mindfulness meditation, and I do that twice a day myself.
Yeah.
So that's helpful. I've added the far infrared sauna, which is a marvelous addition. So I do
Tell
that
us what
40
that
minutes.
is.
Far infrared sauna is a sauna that's dry heat, and it penetrates the skin probably 4 to 5 centimeters or so it gets into your skin and makes you sweat, which is another detoxing sweating. I'm not really a sweater, so it's helped me in terms of that. And that also helps with heavy metals that I got during the chemo, which is the cisplatinum. So that helps detox from that. And I also found on my journey with Gerson that the mercury amalgams in your teeth, they feel that causes a toxicity that impairs your immunity.
Really?
So I've recently got one of those removed, and I also got a root canal removed as well. So that was also infected, and they feel that adds to your, getting them out adds to your boosting your immunity. And I did test positive actually in the blood and urine on mercury, lead, antium. Yeah, quite a number of. And I didn't even live in Flint, Michigan with the lead, so it was like I don't know where I got the lead.
Are tests like that available for
Yes.
everybody?
Yes. Traditional MDs don't do those tests, but